This presentation will focus on processing techniques and skills. These are essential to ensure the activity is a therapeutic intervention versus just a diversional activity. Processing allows the participant to make the connections from the experience to life and to help identify potential areas of growth and change necessary for treatment success. This slide will highlight a variety of processing options available to the professional. Techniques include debriefing, no loading, metaphors, and/or journaling. No loading is a technique that lets the activity speak for itself and is used when the meaning is self-evident. Front loading is an approach that includes framing and pre-briefing that gives the clients a heads up on the point of the intervention. This allows them to focus on relevant issues. Metaphors use an idea or description to symbolize a similarity. For this course, many of the activities we will do will focus on debriefing, but there are other ways to include processing into the intervention. For your intervention protocols, you will be asked to select a processing technique to include in your debriefing session. You will be expected to use one of the ones discussed in the rest of this presentation. In addition, you will need to use a different technique each time you are asked to include one in your assignment. You will notice that although each processing model is organized slightly different and uses different wordings, the sections have a lot of similarities and focus. The what, so what, now what model is used to ensure you are looking at what happened in the experience, what was learned, and what impact could it have on one's life. When using this model, you must include questions under each category to drive the processing session. The what questions give the participant an option to review what happened in the session. Questions might include what happened, what behaviors did you observe, or what feelings did you have during the intervention. The so what section provides them with the opportunity to draw some meaningful conclusions about the experiences. Questions should include, so how does this activity apply to your treatment goals? What outcomes are relevant for your actual life? And what impact did the activity have on you? Lastly, the now what gives the opportunity to apply the experience to your life. Questions may include, what changes would you make based on this experience? Or how can you apply these skills in your daily life? The experimental learning cycle model has 5 phases: experience, publishing, processing, generalizing, and applying. Experience is just like it sounds. It is the participation in the actual intervention. Publishing provides the client with the opportunity to talk to each other about what happened. Questions to include in this section might be, what happened? What did you observe? Or did anything surprise you? The processing section provides the group with the opportunity to make interpretations about what occurred. Questions appropriate for this section could include, why do you suppose that occurred? What did you learn about yourself? Or what did you learn about others? The generalizing portion is designed to help the clients make connections to the experience to your actual real life. Questions might include, how does this relate to your situation? What does this suggest to you? What patterns or similarities come to mind? The last section is applying. Applying is the time where the clients make some decisions about potential change and learning that came from the experience. Questions might include, what will you do differently as a result of this experience? How and when will you apply your learning? How will this help you be more effective in the future? Or what's next? The ORID model is an acronym for objective, reflective, interpretive, and decisional. The objective section refers to the experience itself. Questions might include, what did you see? What did you hear? What did you observe? What happened? Or what did you notice? The reflective section focuses on the emotional component of the experience. Appropriate questions might include, how did that make you feel? What emotions did you experience? What surprised you, or did it bring up any memories? The interpretive portion is where one creates connections between the experience and one's life. Questions might include, what did you think about the experience? What was the purpose? What was the point? Or what did you learn? The last section is the decisional section, where one is encouraged to identify behavioral changes they are willing to make based on the experience. Example questions might include, how was this helpful? What can you take away from this? What changes will you make based on this? Is there any future impact? The 5-question model is often a student favorite because it really does just focus on 5 questions. Listed on the slide with some slight modification. Question 1 is, did you notice ... where the facilitator adds the events or behaviors that occurred during the experience. The other 4 questions are often just used as they are written in the model. Why did that happen? Does that happen in life? Why does that happen? How can you use that? In actual practice, you would be able to just use the 5 questions in your protocol. This is not the case for your assignment in this course. If using this model, you will still be expected to identify different probing questions that would be appropriate for follow-up discussion under each of these models' questions. I hope you now have a deeper understanding of processing models and how to apply them to your interventions.